Today what I'd like to do is explain a little bit about using multi-radiance laser and how I use it in my office and the rationale of what I use. I try to keep it very simple when I'm teaching doctors and therapists how to use the equipment. I believe honestly that keeping it simple gives us better efficiency within the office. May you be using it yourself as a physician or therapist, or if we have another individual that's designated to do the laser therapy on our patients. So at first what we're going to do is just turn on the box. As you see, when we turn on the box, it says, do you want to test emitters? The emitters can be tested by using this testing pad. Typically, I will say this arrow and hit the word that says no, and it pulls up our preset programs. There's different programs throughout this, and the preset will tell you it's deep chronic pain, and that's what you might be treating. However, I like to keep it simple by going to the manual mode, which is 2 clicks on the program button to bring up the numbers. I believe if we understand the frequency that we are delivering the wavelengths into the body, helps us really understand of what we're treating and how we're treating. The idea by knowing the frequency is you'll be able to treat any condition, determining what you're trying to treat. Are we treating tissue regeneration, or are we treating inhibition of pain and spasm and so on? So again, looking at the numbers, this is 5 hertz. As we arrow up, it goes to 50, 250, 500, 1,000, and 3,000 hertz. To give you a good rule of thumb, when we look at this, as we're at 500 hertz, anything above 500 hertz is inhibition. Anything below 500 hertz is for tissue regeneration or stimulating the cells. So when a patient comes in my practice, the patients are in pain. So I look to use the higher frequencies to bring the pain under control. So I may use up to 3,000 hertz if the patient is in significant pain. The idea behind this is patients want relief. Our population in our world is all about an event. They're used to taking a pill and getting relief. So when they come to your practice, when you're using laser therapy on them, as we know, they feel nothing. They very seldom hear anything. So there's a lot of doctor or therapist-patient trust. So this doctor-patient trust, you have to explain why we're using what we're using. So again, the best patient is an educated patient. What I have found by using multi-radiance equipment now for over 7 years is that we have a frequency or a mode here for sweep. I'm a big component of sweep modes because we know that tissue will build up an adaptation to one particular wavelength or one particular frequency. So if we're varying the wavelength and the frequency, the point is that the cell is less likely to build up an adaptation. So since the frequency sweeps are in here now, you can go to 5 to 50, 5 to 250, you have 5 to 500, or we start moving to the upper branches of 500 to 1,000 or 1,000 to 3,000 K, and K means 1,000, it's abbreviated. Sweep. In my practice, I predominantly use a sweep because I have found clinically I get faster results, and this is something I have determined over the years of treating hundreds, if not thousands, of patients. So again, I like to use the sweep mode. If we're looking at 1,000 to 3,000 hertz sweep, we understand that we're inhibiting 4 major things. Pain, as what the patients brought the patient in. Spasm, typically they say they have very significant spasm. We inhibit edema and swelling. We really truly don't want to inhibit inflammation because inflammation is the precursor of cell regeneration or cell healing. So even though we're on this high frequency, sometimes we inhibit it, but that's not our major goal. When we're looking at tissue regeneration, what that is we're stimulating the inflammatory process to push it along through the phase to allow that single cell to quit producing inflammation and have it be able to push through the whole inflammatory process and heal. Once it heals, the edema and swelling in the area is much less, pain diminishes. So at first, the first 3 to 5 visits, I might use inhibition. After 5 visits, what I typically do, we'll move it to tissue regeneration. A couple clinical pearls I like to express right now is a lot of patients are looking at having a particular amount of relief. So how do we base on how well the patient's going to respond? I think the biggest thing is some of the research is showing that acute pain typically we respond about 80%. Chronic pain is typically around somewhere in the low 70s. So what I tell a patient, if they're acute pain and their pain is at an 8, and I start treating them, I tell them that we should have significant improvement. Somewhere around 80% of the VAS of 8 is around a reduction of 6 points. So we should be able to bring this patient's pain down to maybe a 2 or a 3 on the pain scale. If it's chronic and they're chronic at an 8, we know that typically it will drop anywhere from 5 to 6 points. So that patient will be somewhere around 3 to 4, maybe 5, depending on the chronicity of the individual. Another clinical pearl is I look at the habits of that individual. If it's a healthy individual, they should respond quicker. As we all know, no matter what type of treatment they are getting, maybe physical therapy, chiropractic, medical care, or if they have a lot of bad habits, they're overweight, they eat Twinkies, they smoke, they drink alcohol. We know that all these factors will play in a role in slowing down the healing process. So upon my history, I make sure I know what the patient may have and what the patient's habits are. So it gives me a better understanding to give them a realistic view of how rapidly they should respond. We also have what we call a decade rule. This is kind of the clinical pearl number 3. The decade rule is determining how fast the patient should see significant improvement. Now, I'm not saying the patient's pain will be diminished totally, but significantly seeing some improvement started. So the decade rule is for every 10 years that you're on this earth, it's usually 1 treatment. So if you are 30, we're looking at 3 visits. You are 60, you're looking at 6 visits before we should see some significant improvement. Now, I explain this to the patients because I want them to see this progress. I want them to have realistic goals of when we should and should not start seeing a relief. So, for instance, if we have a gentleman that is 62 years old, the decade rule would say approximately 6 visits. But if we know his history and his habits, he's a smoker, he's a drinker, he's overweight, those will significantly increase the amount of visits before this individual should see this significant improvement. So for instance, if he has 3 or 4 bad social habits, I would add 1 visit for each of those. So instead of being 6, he had 3 bad social habits, I would say you should see significant improvement around an 8 or a 9. And I explain why, because the patient needs to understand that their health habits has a direct effect on their overall health condition. So again, I use the decade rule is very important. I also use the VAS or the goals to tell us how long or what we should be able to decrease their pain in. And I also tell them in regards to maybe some home health care and what they can do to help themselves. Because we know that sometimes when the patient is not responding to the treatment of laser, it's not typically the laser isn't working, it's what the patient is doing outside the office that's slowing the process down. And we need to relate that to the patient.